Hi, and welcome back to another of our Hoag live stream lectures. I'm Dr. Rachel Zabana. I'm the pediatrician over here at Hoag Medical Group at Foothill Ranch office. I've been with Hoag for the last, coming up on 6 years now. And today we're going to talk about vaccines. I know it's a hot topic. And everybody, I'm sure as soon as I said vaccines, everybody sitting watching me cringed a little bit because you know that we're going to talk about things that a lot of people are not comfortable with, which sadly it shouldn't be, but I think it's a topic we do need to address, not just for childhood diseases, but for what's going on with the pandemic and the COVID vaccines. So I think this is a great time to do so. So in general, why do we vaccinate? That's usually the question that's on everybody's mind. And as soon as you say why vaccinate, you can almost break the room in half. Those who say we don't need it and those who say, oh my God, why aren't you vaccinating? But we got to find a common ground somewhere, and to do so, you have to find out why we're vaccinating in the first place, what's a vaccine, and what is it that we're preventing or improving upon. So vaccines, as we all know, you've probably heard this many, many times. Vaccines prevent serious childhood diseases, and that includes diseases that we cannot treat with medications once you have the infection, or diseases that are caused by bacteria that are resistant to our antibiotics, or viruses that by the time we realize you have it, may cause serious damage in the future and cause lifelong disability or even death. And that includes bacteria and viruses, and not just one or the other. So, to understand what's going on, you have to understand the history of vaccines. They came about very early on. Actually, the first vaccine was in the end of the early 19th century, and it happened pretty much by accident. And the doctor who created the first vaccine was treating chicken pox. I'm so sorry, smallpox, sorry. There's so many poxes out there. But there is such a thing as cowpox disease that used to affect cows. And the doctor's name is Dr. Jenner. And he noticed that the milkmaids that were milking the cows and taking care of the milk process didn't really get smallpox as did the rest of the area where they were living, or if they did, it was a milder disease, and somehow it was too noticeable. So what he ended up doing, he checked their blood. He figured out that their blood contained something antibodies basically, that looked different than other people's. So what he did is he took their blood and he created the first vaccine, just to make it simple. And he actually administered the first vaccines, and then that's where we started with vaccinations. And vaccines have been around for centuries now, and vaccine hesitancy, as I'm hesitating as we speak, also has been there at the same time. And it was Dr. Edward Jenner, by the way. And the name vaccination came about from variola vaccina, which is, variola is variolation, which is the process of making a vaccine back in the day. And vaccina was based on, because you got it from cows, and vaca is the French or Spanish name for cow. So just FYI. And the development of vaccines, it's not like something we do right away and here we go, everybody take it and we'll see what happens. It is a long process. I know with the COVID vaccine, you almost got to see it firsthand in fast motion almost, because the reason we were able to do that is because this was an effort by the entire world working together to solve the problem of the pandemic as fast as we could. And that's the reason we were able to do this. It's all about collaboration, and it was a wonderful way of seeing that. The other vaccines, if you wanted to take a quick look, I wanted to put that out there because it kind of shows you the progression of how we came about with all the vaccines that we have today and how they were introduced and became part of our everyday thing. But not to diverge, I just wanted to show that so people can have an idea. So what are these vaccines that we're all talking about? There are several types of vaccines. There's inactivated vaccines, there are live attenuated vaccines, there are toxoid vaccines, and of course now we have the mRNA technology that we made the COVID vaccine from. although mRNA vaccine is really not a new technology, it's been there. We've been working with it. It's just now becoming more popular because the COVID vaccine is the main ones that we're using are based on mRNA. So inactive vaccines are basically, they don't cause disease. They contain some portion of the virus that we want the body to see and recognize and make memory cells of it and kind of remember it, so that if you come across that specific infection or that specific antigen or virus, you would recognize it fast and jump on it and treat it, and to the point that your body wouldn't even know that you were doing it, because that's the job of your body. The job of your body is almost like, think of it as like a big company. There's a lot of little workers, a lot of different departments, and you on the outside is the building that looks beautiful, and the and all the products that you're making, and you're surviving and you're becoming a productive person in life. So part of your body has to do with keeping it rolling, keeping it stable and healthy. And vaccines are one way to try to make sure, optimize that immune system that you have. So, different types of inactive vaccines are hepatitis A vaccine, hepatitis B, the H influenza B or Hib vaccine, the pertussis vaccine, the polio, the inactive polio, the injectable one, is an inactive vaccine. You cannot get the infection from it, or less likely. PCV is the Prevnar vaccine that we use as well today. The live attenuated vaccines are a little bit different. They are a form of the virus, but it's on a weakened version. And these are actually very effective because they give you lifelong protection, and that's the reason you don't need as many of them. The inactive ones, you may need several to kind of boost your immune system and keep it going. The live attenuated, generally you don't need a lot of boosters. The reason boosters do come up every now and then for these is most likely because we are living longer, and our immune system can wane after about 15, 20 years. You may need some boosters. Types of that is MMR, the chickenpox, the oral version of the polio vaccine, TB, the rotavirus vaccine, and of course smallpox, which we'll talk about a little bit later. These vaccines, you have to be careful when you have a truly immunocompromised person. Somebody who has seasonal allergies, even somebody who has asthma, you still can have those. They're very important, because somebody who's always sick, somebody whose immune system is a little bit irritated a lot by these seasonal allergies, by the pollution, by things like that, it's actually a good thing to have vaccines, because you want to boost that immune system because of the fact that you're more likely to get sick because your body is too sensitive to things, in a way. But truly immunocompromised people or children are kids on chemo, kids on medications that really, really plummet their immune system because we're trying to control an infection that they have, or like an autoimmune disease that they have, and which now we use a lot of biologic medications and medications that really plummet your immune system. So you have to be careful with those people, which is where the idea of herd immunity comes from, to protect those kinds of people that really, really cannot do it for themselves. We want to protect them. Toxoid vaccines are inactive. They're based on a bacterial toxin, and they tend to, we need them to protect ourselves from infections that can be pretty serious, like the tetanus, diphtheria, things like that. mRNA vaccines are the ones that where you actually take a piece of the it's not the DNA, it's actually the messenger RNA, the one that actually has the blueprint to make the virus. That is what you use for the Pfizer and the Moderna. And the idea behind that is to give your body the blueprint. So your body looks at it, makes notes, makes memory cells, puts it on the side to protect itself for later. So if your body happens to notice that this virus is there and it recognizes it, it already has the blueprint. It already made notes for itself, like the cookbook, and it'll start making antibodies against it, and hopefully stop you from even getting that infection if you get exposed. Vaccine hesitancy. Even though we do give vaccines, nothing is magic. There is no magic pill, there is no perfect answer, there is no perfect medication, and there is no perfect thing in life. If somebody says this is perfect, it will fix everything, something's wrong with it. Because life is ever evolving. We don't live in an isolated environment. It is a whole ecosystem. And we're all pretty much evolving to survive more and more harsh environments, to protect ourselves against more and more predators, for example. That includes viruses, bacteria, the occasional mountain lion that comes into our neighborhood. You know, you have to be ready for anything. So, and so everything does come with some risk, but mainly more benefit when it comes to vaccines. A lot of parents, there's basically 3 types of people, and let's say parents because we're talking about children in here. So there's mainly 3 types of parents, and that includes me. You know, I'm not a parent, I'm a godmother, and I love my my godkids, my godchildren, but again, I still think of my parents and my family as well. So we've got the parents who act as advocates, who already are for vaccines. They are trying to get everybody on board, and they're kind of being proactive and trying to understand and continue to understand the reasons for vaccines, and we go ahead and do them. We follow what we're told. Compliant parents are the ones that really, as long as it's required, or if it's important and the CDC says so, I'm going to do it because, you know, I've got other things to do, but I know this is important because I trust the person who's telling me, let's move on and go. The hesitant group is the one we worry about, because that's the group that can get swayed either way. And I'm not saying one group is correct and the other one is wrong. That's the thing we're trying to stop. This is not a blame game. This is more about taking care of ourselves as a society, and kind of looking to the sides and seeing who's next to you. You want to protect them as well, because if you protect them, they're protecting you, and the whole system works better. So the most important thing when we're talking about hesitancy is to kind of address it properly. People wonder things like, which you read on the internet, vaccines don't work. There's too many of them. The baby's too young. They're very painful. They can cause autism or other diseases. They have terrible side effects. I know so-and-so who died after 5 minutes of getting a vaccine, or six years later they became like that, or an hour later they had a fever so bad that we had to go to the emergency room. You know, I'm just giving examples. And then people also worry about the ingredients in it. There's so much out there in the information highway, and then there's also peers, family, and just in general, just like you're in any group, there's always, whatever group you're in, you all identify with the same thing. So we have to make sure we're all on the same page, and why are we doing it? So do you vaccinate, do you not? Maybe, why? This is what we want. We want a happy, healthy baby doing natural things, even eating natural foods. And I get that. We're all about non-GMO and things like that, which is absolutely an important thing. But the problem is people look at vaccines like that little picture of the baby screaming and crying and, oh my God, look at all these jabs and they're so painful, and look at how many people are touching the baby. It's not quite like that. We want to kind of turn our heads and look at the baby that's eating healthy food and smiling. That's because he's vaccinated and he can go around, running around, eating whatever he wants and having a good time, because we've protected him from the inside out. So should you delay or should you spread out? That's another issue, because when you're hesitant, sometimes it feels better if I delay them or if I spread them out, because if I spread them out, it's not as painful. We don't get as much at the same time because we're not overwhelming the system. There is no advantage whatsoever to delaying or spreading out vaccines. And actually, I did sit down one time and I did separate them, and I did, just to see, you actually end up giving more vaccines, more jabs, more exposures, if that's what you're worrying about how much of this vaccine that you're getting. You actually end up getting more for no benefit whatsoever. The other thing is, we don't know the efficacy and the actual outcome and the immune response of the child's body when you're spreading them out, separating and delaying them, do this but not that, do those together but not those, because there is no data on that. We've been studying the vaccines since they were made for over 100 years, and studies are continuously going on to make sure those vaccines are still working, and how long are they working for, and can we make them better? Can we make them can we get them to the point where they have less side effects? Can we combine more so you have less jabs and less of the antigen inside that vaccine? The other thing is, oh, this is way too much stress on the body if I'm going to give you 5 today. There is no difference on the body's response if you give 1 vaccine versus 5. You know, I don't want to give 6 or 7, but I have given 5 before, and there's nothing wrong with that. Your body's going to have the same reaction. You're going to go into that stress mode the same way. You're going to produce the same amount of cortisol. So if you think about it, if you're spreading those out, you are actually stressing the body even more because you're bringing it on more times. Not to mention that you're going to come to the office more often. The child is going to cry more often. The child is going to feel like every time I come into this office, they hurt me. I'm going to cry. I don't want to go. And it's almost like the dentist. Nobody wants to go to the dentist because you remember every time you go to the dentist, you hear that drill. You know they're going to pick at your teeth. You're going to hear that bad news. You're going to get, you know, we don't want that experience for the child. We are trying to focus the attention on having an important, healthy child that does not get the preventable diseases. The other thing is there's way too many vaccines today compared to before. Yeah, because we have more information, we have more technology, and because we know what else to do to try to prevent your child from having to go through that infection that we got to go through as children, to create natural immunity instead of getting the vaccine, creating the immune response that we need, hiding it away without actually having to go through the painful process of having chickenpox and having that itchy everywhere and feeling miserable and having the fever from it and missing out on school, missing out on going to a trip, and oh my God, I'm gonna expose my little newborn baby and this pregnant mom who's sitting right here taking care of the child who has it. So again, I'm over exaggerating in a way because I'm trying to put it in perspective, and I'm trying to bring it out to what it is that we're doing and why, and what it is that you're missing out on, or maybe the burden on yourself and your family when you're spreading out the vaccines or delaying them. And then we'll talk about a little bit about the toxins and the additives and all these terrible things that are in vaccines. We are constantly evolving. Science is always improving. That's why we do science, because we're trying to find answers and we're trying to improve everything. So there are things in there to protect it. There's a reason for everything that's in there. Just like if you pick up a bottle of formula, there are additives there. They're there for a reason. They're there for consistency, to protect it from becoming infected, from overgrowth of bacteria if you leave it on the shelf for too long, etc. And then of course the final thing is, I think, is one of the most important thing is the parental concern, the fear, that feeling of I'm going to be responsible if something bad happens if I give my child that vaccine. That's a huge burden that we keep putting on parents, especially moms. And I say moms, I don't mean that, and I mean it to be more isolative, but generally moms are the ones that make decisions in terms of medical decisions for a family, but dads as well. So parents in general, we throw so much information on them, and we also, with that, throw that fear of it's your fault if something goes wrong. Now this is what you did. It's your fault. It's not their fault. Nobody's fault. It's not a blame game. It is, our goal is all the same, for all of us is the same. We're all trying to make sure that our children are healthy and become productive people in the future without having to go through terrible things. So addressing the parents' concerns and their beliefs properly and truthfully as much as we can is the most important thing. I put a website down there. It is from the CDC. It talks about vaccine safety. And yes, there is a vaccine adverse effects hotline in case you do have vaccine adverse effects, because we are, again, keeping track of what's going on, who has what, and this is worldwide. So when you talk about stress on the body, newborns have an immature immune system to begin with. They are vulnerable to these actual diseases that we're trying to prevent them from having. And yes, like I said, the number of vaccines have increased, but the actual total load of antigen that are in the vaccines has actually decreased because of the technology we have. We can put more in a smaller space, just like your phone. It gets smaller by the second. Every time you buy a new one, the technology in it, the chips in it are getting smaller and smaller because we're able to do that because of better technology. And the other thing I was going to mention, when people say there's a lot more vaccines, well, count how many things right now that are around you that you are using for technology. You've got a phone, an iPad, a laptop, a desktop, a TV screen, an actual regular TV, and then you go in the car and you've got the GPS system. Why? Because we can, because we have more technology to help our daily lives to improve. So if that helps to make you feel, make you kind of experience a different way of it. And babies can still get vaccines even if they come in with a slight cold, they're congested, they were sneezing or coughing, they can still do that. It's very, there are very specific times where we say, you know what, the child is sick, let's wait on the vaccines. That's usually if they, for example, they have a fever of 104. I'm not going to give them vaccines. We need to find out what's going on. We need to get that under control, and then we can talk about vaccines. If a child is lethargic, has a strange rash that we don't know where it's coming from or what's going on, if the child is visibly ill, that's not the time to talk about to give the vaccine at that moment. That visit should not be a well visit, should be a sick visit. So, but if you come in, oh my gosh, they started sneezing yesterday and they're congested and they're teething, yeah, I'm still going to give you the vaccine because I want to boost your immune system to help you through whatever it is you're going through. It may not be exactly specific to that, but it is overall boosting your immune system against everything else around you. Let's see what I have here. So, the other thing I like to show parents is, for example, Prevnar. Prevnar is great because the three main bacteria that cause ear infections, one of them is pneumococcal pneumonia. Pneumococcal pneumonia can cause pneumonia, but it can also increase your risk of getting recurring ear infections to the point that you need ear tubes. If I have, and you may sit there and say, oh, so what, my child can have an ear infection, I'll just give him amoxicillin, it will be fine. But you got a child who's in pain, who may or may not have really bad fevers, who is not sleeping and crying because of the pain. By the time you come in for a visit, and then we see or may not see an ear infection at that moment, and then you give the amoxicillin. The amoxicillin you're going to take twice a day for 10 days. And I'm not putting blame on amoxicillin. There's other vaccines, but I'm just giving an example. So, and I purposely put those two pictures up there to show the difference. If I gave Prevnar vaccine, it boosts your immune system. You may not get ear infections or recurring ear infections, or even if you do, you may get better without the need of antibiotics. If I give antibiotics, you're going to take however much per weight of that child at the time, twice a day for 10 days. You're also going to take time off from work. You're going to have to stay home and give the medication that tastes terrible. You're going to have to fight your child to take it. The child's going to spit it up. So if you think about it from a daily routine, normal life, it makes more sense to just give the vaccine, boost the immune system, let the body do its job, and not have to rely on the medications all the time. But not to say that nobody ever gets an infection because they're vaccinated. You're still going to get through breakthrough infections, which we see here with COVID. You get vaccinated, some people are still getting the infection, but the infection is less invasive, less severe, and they recover faster, and they're less likely to infect other people around them. And then I wanted to put this picture to kind of make it a visual thing that, oh my gosh, it's too many and it's too soon. No, the whole point of giving vaccines to a baby is because the baby doesn't have the immune system that we have. It still has to go through daily life to build up that immune system. But if I come to you and say, listen, you want to create a brand new business, here, start from scratch on your own, no advice, go. You're still going to make it if you have the drive and you've got the tools and you have the backup. Yeah, you will. But wouldn't it be a lot easier if you got a mentor, had some resources to help you, get a plan from somebody else and kind of work together? It makes more sense to use the resources you have. And the biggest thing I tell parents is stop counting them. It's not about counting. These are 0.5 milliliters versus 300 milliliters of amoxicillin or some other medication. So it's never too soon. And of course, the biggest success story we have in vaccines is the smallpox vaccine. And I have to say, the reason that we were able to do that is because the smallpox virus itself is not the smartest. It was very slow to change its own, or what's the word I'm looking for, to mutate. And that's one big reason we were able to contain it. The other big reason is because there was a huge worldwide push to vaccinate everybody. And that's how we stopped it in its track. We stopped it before it was able to mutate, to become something else, to become something more virulent. and by vaccinating. And that's what's happening with COVID. That's the problem with the flu. The flu vaccine is extremely smart. It changes itself almost every year, so that to the point that the vaccine we make today, 5 years from now, may not be effective, which is why we always work on the yearly vaccine for flu. Viruses are very smart. They need to survive, and to survive, they have to evolve, just like we do. We evolve, we use the technology we have, so do the vaccines. So it's kind of like a fight. They are the enemy. We are trying to save ourselves from them. So, and the example the picture that I have up there is the example. These are twin brothers. One was vaccinated, one was not. The one who wasn't vaccinated got the smallpox. It's a horrible, terrible disease. You do not want to get, I mean, thankfully we don't know anything about it. We don't see it. It doesn't exist except in laboratories. But it used to wipe out civilizations fast because it was so bad. And as you can see, the last natural outbreak of smallpox was 1949. And in 1980, it was declared completely eradicated worldwide. So that's our goal. So vaccinate, you want to be on the kid on the left side, the healthy one. So what's in vaccines? There's water, there's preservatives, there's adjuvants. The adjuvants are the ones that people panic about. That's the formaldehyde and the mercury is a different thing. We'll talk about it in a minute. Antibiotics are for the preservatives and to keep it sterile. Aluminum is the one I was trying to remember. So the reason for the adjuvants, that's the reason we're able to give less antigen, the reason we're able to combine vaccines to give you less shots, less physical pain. And it helps to create the vaccine that is optimal to help you make a better response in your immune system, to better protect you from actually getting those vaccines. And of course, residual traces, that's the formaldehyde. The thing is, the words, I think, are what trips people. You do need preservatives, because otherwise, if I do something without a preservative and I put it on the shelf, who knows what's grown in there? I need to make sure that thing stays sterile, because I'm not going to put that in my body if there's no preservatives, if I know that there could be a problem with it. And of course, the active ingredient is the actual portion of the vaccine, of the virus that we're trying to include in your body. So this is pretty much really quick how the vaccines work. Your body is there, your white cells are there, the fighting cells, they see something they don't know. They're gonna call upon their friends, come over, let's look at this, we replicate, we get our antibodies made against that specific thing, and we start fighting, and we clean it up. Then we make memory cells. Those are basically our guards. That's in a nutshell. So, vaccines do have side effects. Nothing is perfect. So, when they do happen, they generally are mild. Things we know about, the things we usually see is they're sore at the site, there might be pain at the site, some redness, some swelling, mild fever, maybe a little bit of a rash. Less common are the side effects that people worry a lot about, which the risks that are extremely rare. And I think I was looking this up and it said 1 in a million child will have this rare, terrible adverse effect. You're 100 times more likely to get, you're more likely to get struck by lightning 100 times than to get that serious reaction from a vaccine. But that's what pediatricians are for. We want to make sure we have a happy child, and we have a truthful and good communication with the parents. This is what we're preventing, these things. This is what we forgot about, because we don't see it anymore. We don't see polio. That's polio. The child that can't walk anymore, they're paralyzed. That's polio. That's what we're preventing. The child that looks like they have a big fat, that's mumps. That can cause sterility in boys. And the poor child on the left, the cute child with the, I actually put a nicer picture. I didn't want to put the terrible pictures. That is measles. And it's terrible. And you can have lifelong problems because of measles. You can have limb damage. Meningitis can give you limb loss. The other issue we worry about is we need to vaccinate because we want to protect that fetus of that pregnant mom that's sitting right next to you, because these diseases can cause miscarriages, they can cause problems after birth, they can have children born with, or babies born with horrible deformities because of these. So again, this is what we're trying to prevent. It's hard to see something that you're preventing. So this is the recommended schedule. I mean, there's nothing wrong with it. We do it, I try to do it as much as possible at the same way to minimize any mistakes, to minimize any new appointments that you have to come to get, and to just follow it so that we have it done and ready by the time they're at school. And I also put the entire, kind of like a shortcut of from birth to 18, the different vaccines. And again, please don't sit there and count them. Some of these are combined, and some of these you don't need that many vaccines, that many booster vaccines, because then there are different ones where you only need 2 doses rather than 3 doses. And the one I forgot to mention, by the way, is rotavirus vaccine. That's a live vaccine that you drink at 2 months, 4 months, and sometimes 6 months, depending on which product you're using. That one causes severe dehydration to the point that children need to be hospitalized and they can die from dehydration. So remember these things. That's what we're trying to prevent. So who makes the decisions for us about which vaccines and when? There's 4 panels of experts. There are variable sort of ways to give the vaccines, but most of us follow sort of a standard way. There's a leeway here and there for different vaccines. And that's usually why you see on the schedule where there's a big, huge block. And I'm going to go back just to show you what I was talking about. Oh, I guess it doesn't work. Oh, there, where you see hepatitis B, and you can see it from 6 to 18. That's because if you're trying to do catch up for some reason they couldn't, you can within that time frame. Let's move on. So the CDC has the Coalition of Immunization Program, and the AAP is the American Academy of Pediatrics, the American Academy of Family Physicians, and of course, before it gets to them, the FDA is the one that oversees all the research and makes its best decisions to make sure what it puts on out for us in the market is safe enough for us to make decisions about. And yes, I know the first thing in everybody's mind is, oh, you said the bad word, FDA, oh, people, it's all, because yeah, sadly, there's a lot of politics going on right now, but honestly, in the end, most of us pediatricians, most of us physicians, most of us scientists, we go into this not because we want to make, I mean, money's nice, I got to pay bills, but that's not our first passion. Our passion is, this is what we love. This is why we spent all our nights up reading and studying and presenting and understanding all this so we can explain it to you, because that's our passion. We're not going to say it just because we have alternative reasons. There's always bad apples everywhere, but that's not most of us. And the other major thing is the biggest thing and the most recent thing I've been hearing from parents is, we don't need to vaccinate because we don't have these diseases anymore in the US. Well, that's not true. The problem is, because we're stopping the vaccinations and we're delaying vaccines, we're starting to see them come back and come back violently. This is one of my favorite screens to show. This is about measles. When we vaccinated for measles, in the year 2000, we actually declared in the US that measles has been eliminated. Not eradicated, it's still around, but it was declared eliminated in the US. We barely, if any, get notified about a vaccine, about a measles infection, because of the huge drive to vaccinate MMR, which includes the measles. But slowly but surely, again, our biggest asset is we forget pain. We forget what it was like to have, we forget bad memories, we block them away because we gotta move on. But the problem is we forget. We don't, our grandparents aren't here, great-grandparents, I should say, aren't here to tell us what happened when they were young. But if you ask your grandparents, ask them how many kids were miserable, how many kids got really sick, how many kids passed away because of these childhood diseases, or are living currently with long-term consequences like polio from that. And as you can see, when you got to the year 2014, we're starting to see a surge. And on top of that, oh, sorry, let me try again. This is what happened recently in 2019. There was a big surge of measles in in Disneyland, poor Disneyland, because there was a huge aggregate of people, kids running around having fun, and a lot of them were not vaccinated. So guess what? The measles had a field day, and it was so happy because it got to spread itself everywhere. And it doesn't sound like a lot, 206 cases, so what? There's billions of people. Well, if you think about it that way, there are billions of people in the world, and if I vaccinate and I get 200 people that got side effects out of 6 billion, that's not a bad thing. But I don't want to be the one that gets the side effects. And again, I don't want to be one of those 206 that got the measles, or my child that had the measles in those 206. Why? When I could have prevented that. So things can, I mean, you can make a comment either way. But again, going back to the main goal is we want healthy children. We want children that are happy and running around. Oh, can I have the next slide, please? I lost the screen. Sorry, my screen is blank. But again, the surge in measles kind of woke people up a little bit, and there were a lot of huge debates about it, and it even made it to the Senate, I believe. But in general, our biggest thing is we want to prevent all this. The pneumococcal pneumonia is another example. As you can see, when we started the pneumococcal vaccinations, again in the 2000s, and it became mandatory, we used to use Prevnar 7, which had only 7 antigens, versus Prevnar 13 that we now use regularly, which has 13 different strains. Excuse me, it's not antigens, the strains, we target strains. As you can tell, pneumococcal pneumonia has gone down tremendously, but guess what? If we continue to delay and not give any, we're gonna run into the problem of the measles. And again, like I said, Prevnar is one of the ones that can help us prevent our child from getting recurring infections. Now, COVID infection, I did mention a little bit about it, and I know our biggest thing is long-term complications. We don't know what's happening because of the vaccine that I got. However, what do you know about the long-term complications of getting the disease itself? We're seeing that now. We're seeing long COVID syndromes, the fatigue people get, the lung disease that people are starting to have as a complication from getting over the COVID infection. And of course, there's also the concern about the cardiac issue from the COVID vaccination, which actually people are not paying attention to the fact that you can get that same cardiac disease from the natural infection itself. And who knows which is gonna be more of a problem later. But again, if you're gonna get it from either or, I'd rather protect myself. At least I have a chance. And I wanted to put that slide up there because, or as a reminder, COVID vaccine is because we want to build our immune system. We want to protect those who are sick and have complications and can't get it. And we want to reduce our chances of getting hospitalized if we do get the infection, even though we got the vaccine. So again, I'm going to say it over and over again. Vaccines are safe, they're effective, they're not perfect, but they are there for a reason. Talk to us. There's no data at all showing that it's beneficial to break them up. It's actually causing more fear and feeding on our fears, I should say. It's almost impairing our capability of doing what we need to do for our children, and it's adding more burden on us because it's making more appointments. It's the parents are spending more time worrying about it, the peer pressure. So they're safe. Go for it. We were all vaccinated. We're going to vaccinate our children. I did add a few websites for parents to kind of get a little bit more information. Feel free to use it. And again, this is our Foothill Ranch office. I wanted to make sure to mention, since COVID is still sort of around, hopefully not for much longer, we are still face covering with surgical masks or some sort of face covering when we are as staff and as patients. When you come to the office, our equipment is are sanitized. We do televisits, and if we need to, we do full PPEs, personal protection equipment. So make sure you make your appointments, and we already discussed why we need to keep vaccinating, but this is kind of a nice way of showing it. The vaccines are basically the umbrellas to protect our children from the rain. So these are our offices. Any questions? hope to see you in our office soon. Have a wonderful time, and hopefully we'll see you in the office, and hopefully I gave you a little bit of something to talk about tonight with your family.